we need to be changing the discourse to say, actually, care is an incredible career.
Not every single human being interacts with adult social care in their lifetime, and that's where that misinformation and miscommunication comes about.
That lack of long-term vision is meaning that people don't have that sense that actually I can have a career here that's not doing this same job for 20 years.
Hello, I'm Suhail Mirza and welcome to this special episode of Voices of Care, which is coming from London's Excel Centre at the Care Manager Show. We're proud to be partnering with Caring Times, and we will be speaking to a number of luminaries right across the sector, highlighting some of the challenges it's facing, but also highlighting some of the great things that are being done every day to deliver the best care to individuals. So please join me on this special episode. Thank you. Delighted to welcome you, Lee, to Voice of Care. It's a privilege for us to partner with Caring Times here at the Care Managers event, and tremendous energy already here this morning.
Yeah, it's amazing. We've got a fantastic turnout, I think. I think we've had over 5,000 people signed up for the event, so it should be really busy on both days. It's looking really good, yeah.
And social care, we're going to come on to some of the challenges, but social care is also a sector that should be celebrated. I mean, you write as editor-in-chief and expert. I mean, the Skills for Care report published recently, over £55 billion of economic value add to the sector. So it's a time with plenty of people that you know in the sector to celebrate its contribution, isn't it?
Definitely. Obviously, care workers don't get the recognition they deserve in society as a whole, really. They play an incredible job in looking after our most vulnerable people, supporting the NHS, and as you say, their contribution to the economy is immense. I mean, obviously, social care is a bigger employer than NHS, and it's high time that this was recognised for the care workforce in terms of a decent, fair salary, and obviously more investment in care as a whole from the government, definitely.
Well, that point you make quite clearly, Lee. We've had a slew of reports recently from the National Audit Office, Care England. I want to turn to the Home Care Association, published its market deficit report in November, and it's asking for the government for £2 billion per annum extra because local authorities under funding pressure are simply not meeting the true cost of care, etc. So this issue has been around a long time. It's still affecting all parts of the sector.
Yeah, absolutely. I think it's been particularly bad in home care, as you sort of mentioned there. And it's a really difficult problem. It's not going to be solved without substantial investment, as you say, from local authorities. But obviously the problem for local authorities is they're trying to stretch their own budgets as well, and they're obviously underfunded themselves. So it's very difficult for local authorities to meet the fair cost of care that was agreed, obviously, within the government reforms. Obviously, Care England research showed there was a £2 billion deficit in terms of meeting that fair cost of care. And somehow that obviously needs to be obviously met by government, really. They need to provide the resources to the local authorities so that they can pay a fee, obviously, to meet the cost of care for providers, and obviously enable providers to pay their workforce a good salary as well.
Yeah, you mentioned the Care England report. Professor Martin Green was on record as saying that because of this funding pressure, we are seeing many care providers and the sector itself in an extremely precarious state, was the phrase he used. I think he quoted up to a third of providers were potentially considering exiting the market. Now, you're very close to many of the providers at Caring Times. That's a huge issue for the whole sector.
Yeah, we're seeing it all the time. Obviously, it's particularly hitting small businesses, family-run independents are really exposed to this kind of pressure, and we're seeing it all the time in terms of closures and people moving out the sector, obviously providers moving out of local authority provided care, which is obviously creating a two-tier system, as I guess we're going to get onto later. The private sector, largely the corporate sector, is flourishing, whereas the small independents are very much getting hit by this hard, obviously inadequate funding from local authorities. We saw this also in the Public Health Scotland report that just came out recently this week, and it's been particularly badly felt in remote urban areas of Scotland, where obviously the care homes really struggle to get the workforce that they need, and obviously they have to go to the overseas markets to attract these workers. And obviously we're seeing this all around the country as well, yeah.
No, you're quite right, and I think that two-tier system you talked about, the CQC report, I think was pulled no punches in saying Ian Trump was very clear about this. Gridlock last year, now we're heading to a place where actually people who can't afford to have their care treated will have to dip into their own pockets. But he highlighted one particular issue, which I know is close to your heart at Caring Times, is that I think over 50% of social care providers are having difficulty recruiting staff, 31% retaining them. That remains really the big hole in terms of there's such brilliant care being delivered, but you need the workforce.
Definitely, yeah. Obviously, it's quite worrying as well what we've seen this week, where we've seen reports only yesterday, suggestions that the Home Office are considering clamping down on the shortest occupational list qualification, and obviously this could have a huge impact on the care sector, which is really worrying because obviously, as we've already discussed, they're very reliant on the overseas workforce because they're struggling to attract the local workforce because of, I guess, the lack of salary options and investment in the workforce that we need so we can hire local people in the UK.
Yeah, because we had 70,000 extra staff internationally from the Skills for Care. Now the autumn statement is still fresh in our ears, and we're deafened by the silence around social care.
Absolutely, yeah. Unfortunately, social care, as you've just mentioned, is a long-term problem and it needs long-term solutions. And obviously the problem with government and politicians is they don't really operate on that sort of timescale, especially with the general election coming up. They're very much tied in now to winning votes in the next general election. And obviously we've seen the tax cuts. And obviously, as I've mentioned, the next worrying thing could be a further clampdown on immigration in order to attract this to win the next election. That's how government behaves, unfortunately.
Well, what can be done? Let's have a little chat around some of the solutions. Care England's report talked about an immediate VAT change for welfare services. A long-term workforce plan is being mooted by Skills for Care. What would you like to see if you had the crystal ball ahead of the election next year?
Yeah, well, we've seen some interesting ideas. Obviously, the Lib Dems are proposing $5 billion for personal care, which is an interesting idea. And obviously, the Labour Party have got this idea of the National Care Service, which I expect is a very long-term option, but there is some potential value in that. And obviously we need to see more integration between health and social care. We need to see social care workers' salaries pegged to the NHS bands, greater integration of the workforce so there's transferable skills so care workers can cross over to the NHS and vice versa. So we just generally need to see a much more unified solution, I guess, between health and social care.
And also on that very final point, because I know you're pressed for time, we need 440,000 more staff in social care by 2035. We're in danger of losing the same number because they may retire during that period. So we're also going to need a bit of a revolution in terms of the way we train and allow access to people who want to actually join this sector.
Definitely, there's areas of the workforce that are really untapped. We've got young people and students. We need to get into the workforce and offer them viable career pathways. And I think obviously that's a potentially long-term solution that we really need to look at. Yeah.
Well, I think you'll be keeping very busy as editor-in-chief as we move into the election here. Thank you very much for sharing your time and insight, Lee. I'm really grateful.
It's a pleasure, Suhail. Thanks for having me.
My pleasure. Thank you. I'm delighted to be joined by Sanjay Dhrona now, the Managing Director of the Close Care Home. Sanjay, thanks so much for taking time out to join us at Voices of Care.
Thank you so much for having me.
It's a real pleasure. You've been here. It's a lot of buzz around here. Care Managers Show. How have you been enjoying it?
It's a really great show, I think, which is very different from the others. And this one is, I think, designed for people very much at the coalface. Yep. So it's really great. I just had an amazing session a minute ago and I was overwhelmed with the number of people that were there.
I saw the queue of people waiting
to
talk to you. I saw you there.
Beautifully flattering, it really is. But it was nice because every single one of them were almost all registered managers. So very much making sure that we're speaking to the right level,
yep,
giving them the right information that they need in their service. And plus it's a nice busy show and you've got Lorraine, Kelly and everyone's here.
What could be wrong with that?
What could be worse?
Now the Close Care Home, tell us a little bit about that. It's in Oxfordshire.
Yes.
And especially a number of services it provides.
So the Close Care Home is located in Peart, Oxfordshire, just in South Oxfordshire. It's a 90-bed care home. We're privileged to care for residents that live with Alzheimer's, dementia, general nursing. We take on some quite specialist needs as well in terms of some residents that live with bariatric needs. As I said, acquired brain injury, and of course the normal palliative residents also.
Now, it's been an extraordinary time for social care. A lot of press, A lot of people criticising the lack of attention given to it in the autumn statement, funding issues. You've been around the sector for some time. It's a sector that perhaps doesn't get the full accolades it should do.
No, and I think that's part of, to be honest, I'm not going to blame other people. I think it's part of our own fault as well. We're not good about shouting about our own successes. The challenging situation within adult social care is that we, as a sector, are seen as a private sector, taking government money, government taxes, and taking money out of people's pockets. And that's where the challenge is. So we need to fix that, because GPs do exactly the same thing. Most GPs are private practitioners into the service providers, into the NHS or their local CCG or ICBs now. So we have to change that dialogue and narrative, understanding that not many people, not every single human being interacts with adult social care in their lifetime. And that's where that misinformation and miscommunication comes about. Those previous bad practitioners that used to exist, they don't anymore, they're gone. This whole new world of providers are around. So it's how do we now tell our stories in a productive way, in an inclusive way, and a way to bring the entire circle of care and the entire communities that surround us together with us. So it's making sure that we're good at our own PR as well. So that we need to start it off first and kind of lose the chip on our shoulders.
No, I think that's very refreshing indeed. I wanted to touch on your speech
Yes.
that was so well attended and so enthusiastic. It's around the theme of having an outstanding inspection day.
Yes.
I guess that goes to the point you've made. We have to speak up in the sector about what we're doing, and that begins with interacting in a empowering way, proactive way with inspection.
So it's our own inspection day, and that's what's really interesting. You are not passive in this process. It is
It's
yours.
normally seen that way. They're
And
coming
it
to
is.
do the inspection.
And
I think
what-
that's what you were highlighting, the ability to have agency around it.
Completely, and making sure that your team are aware and demystified. The regulator is there to do their job. We respect them, they exist, they have a purpose. Yes, I'm not challenging any of that. The question is they're not big scary monsters. They're people. They're people trying to do their job. Now we have the ability to enable them to do it in a productive way, in a way that's beneficial to us.
And you can speak from all the bruises and all the journeys, because
we have been through the ringer.
You have been through an extraordinary journey. So
Yes.
just touch upon that, because actually inspection was very much part of that to make sure you got the ratings you needed.
Totally. So in 2015, end of 2014, under the new inspection regime that Andrea Sutcliffe had brought in back in the day, the old mum test days,
Of course.
the close was rated as fully inadequate, 2 warning notices, 2 embargoes, and in 2019 we had our first fully outstanding inspection.
Wonderful.
Yeah, so we had been through, I think, 5 different inspections in those years.
Wow.
So there, I have been through 2 inspectors and actually worked with them very productively. They supported me, they taught me to some extent, which maybe they won't be doing now as much, but our relationship was ours to forge, and we did that. And don't get me wrong, there were times when we were like, we're taking you to court, and that was great, but we never got
But
there.
your mindset is the thing that comes across really powerfully at the moment, and in your speech, as I caught glimpses of it, is the mindset that you approach it as a partner.
Oh yeah, totally. They're there to do their job. We're doing ours. Let's show off what we do and do so well. And the challenge is for me as a provider, I sit there as a responsible individual or the managing director.
Sure.
I have my 2 epic managers in place. The question is whether I allow them to hold on to and stonewall everyone else out. And the question is, that's not how we do things at the close. That's our statement, that's our part of our values. We make sure we bring people with us, and the big thing that the regulators are looking for now is co-production.
Absolutely. And I
That's
think
their trigger word that they kept saying last year, and they were laying it out, and now you can see it.
You can see it happening.
Loud and proud. They're shouting about co-production. Now, if you can't co-produce with your own team to start off with,
How on earth?
how are you going to co-produce with anyone else?
I think that's a powerful lesson for all of us. One final question, you touched upon it earlier.
Yes.
The idea that we have to have advocacy in the sector about what we're doing, and you use the word inclusion.
Yep.
I know you're very passionate about that.
Right.
Now the skills for care report are showing an slight increase for the first time in the number of men in the
Yep.
sector. We have people from a wide variety of backgrounds and protected characteristics. Can you talk to me about how important that is to be an outstanding provider, and actually how important that is from a moral and societal perspective?
So we've seen it growing. I grew up in this country, and for us, seeing a brown person on TV, there was a big thing. Oh my God, Mom, look, there's another brown person on telly. Or when a brown family was on Family Fortunes,
Yes.
and anything like that. So we know the old adage: to see it, to be it, you need to see it. Now, in our sector, we are going to care for the whole community. So we need to employ the whole community, and making sure it's there is very important. We care for a number of men. Now, not having enough men in adult social care is a problem, so I did a recruitment campaign with the Department of Health and Social Care around getting more men into social care, and that was really big. But my big passion project is through the Outstanding Society, which is a community interest company that's designed for the betterment and the promotion of best practice.
And Zoe Fry you're talking about,
Absolutely.
who has been an honoured guest with us on Voice of
Well,
Care.
she just got her OBE a
She's
couple
fabulous,
of weeks
yes,
ago, and she
yeah.
was recognised for that, which is so well deserved. And she's an icon, and I look up to her, and I'm blessed to consider her a colleague now, rather than just somebody that I know in the sector. Now she's an actual friend.
So
and
you're
a
driving the
respected-
inclusion piece as part of
So
your work.
part of that is the Outstanding Society's Diversity Forum, called Outstanding. And the best thing is we're going to be representing in 2024 at Pride in Birmingham, at Pride in London, and that's a chance to first gather the community of people that work in adult social care, show off that this sector that employs nearly 2 million people is as pastoral, is as inclusive, and we will care for the residents, but we will employ the people as well, because that's what we struggle with. Why not show off to the right people who have the emotional intelligence to work really well in our sector and make sure that they feel welcome? So we're going to do all of that, and on top of it, then eventually we're going to start coming out with policy that affects actual care.
Well, on that extraordinarily inspiring note, Sanjay, thank you so much for your time
Thank you so
today.
much for having me.
My pleasure
Thank
indeed.
you.
I'm delighted to be joined by Charlie Jones, Care and Clinical Director at BKR Care Consultancy. Charlie, thanks for taking time out on your busy day to join us on Voices of Care.
Pleasure. Thank you very much for inviting me.
It's quite a busy day, isn't it? You've been, I know you've been a speaker, which we're going to come on to, but what have you found from the show today so far?
So really busy, lots of managers as you'd expect. Often you have a provider event or a manager event, and it's often the opposite that comes. And lots of curious minds as well, people that have come with set questions that they want to get answers for, or people that they wish to speak to over the show. So
Yeah, I've seen a lot of people, and a lot of people are listening to what you were saying now. You're a clinician, a nurse. BKR, we know, spends its time advising right across the health and social care landscape.
absolutely. So we cover the whole of the UK, anything registrable for children or adults. That can be private, NHS. It's often a combination of both, and we can be commissioned privately and by authorities as well. So really we see the full breadth of the UK.
I hate to remind you, 20 odd years ago, in terms of your qualification, it's much, mine goes back a long way back in the legal profession, but it's been a huge change in those 2 decades. The CQC plays a fundamental role in safeguarding standards, improving standards as the regulator, and its CEO Ian Trenholm was a guest of ours and talked about dynamic regulation. Now, you spoke today around the whole regulatory regime. What were the 2 or 3 key points that you were hoping providers would take away? Because there is a new regime, a new launch of the way they're approaching the inspection responsibility.
Absolutely, and I think that the main thing is that many of the questions stay the same, because of course the people we're looking after, the buildings in which we're looking after them, are the same. What the onus is changing for me is I'm coming in to check on you and see what you're delivering versus you can evidence to me what you're delivering remotely. And the reality is probably when we respond to a complaint or we're doing that process, we're doing it retrospectively and reactively. What we're trying to move towards is perhaps a situation where actually we're thinking through those inevitables and we're having a plan in place in advance. Here's our documentation to evidence why we've done that.
Now, we haven't got time to go into the depths of this, but obviously you said the whole of the UK. Now, the regulatory regimes vary across the entire UK. Is that a big challenge for you in terms of adapting to all of these things? I know the Care Inspectorate in Scotland have issued a new strategic document, so it's an ever-changing landscape that you're having to deal with.
Absolutely, but I think that's a positive thing. And I think people see it as changing goalposts, and actually what we're doing is reframing questions to ensure that we're not ticking a box. And I think often what we hear from providers when we're brought in is, I need to tick this box for CQC. No, you need to do this for the person in front of you. And that's irrespective of whether the individual's in Wales, Scotland, Ireland or England.
Well, another regulator, the Northern Ireland Social Care Council, has issued its new strategy. It talks about one of the key aims is to empower the workforce. Now that's also right across the UK. I wanted just to focus on workforce because whatever we're doing in social care, it needs to be absolutely centred around the organisations being well led and opportunities for career progression. Are you seeing providers really focusing on that? What are you seeing in terms of the regulator understanding that that's a tough environment given the current funding constraints that people are dealing with?
And that's the thing, isn't it? Because as providers and individual settings, what we worry about is train those staff up, I haven't got somewhere for them to go yet, they'll leave. Of course they will, but if we're all doing the same thing, then actually some will stay because they like you as a provider and many will go off elsewhere but be replaced by people equally well trained. And for me, it's about that journey that every staff member should go on. Otherwise we lose them to other sectors because of the fact that Asda's paying more, plus you get your discount. So if you're to keep their interest, we don't have a workforce now that are here to do a job. They want job satisfaction, their own job satisfaction. We've got to find a way of giving it them.
Well, you're right in terms of the turnover figures. I mean, they've improved over the last year. In England, Skills for Care report, 10.7% turnover rate down to, I think, 9.9%. 390,000 people leaving their roles, a third leaving the sector. I wanted to look at training finally. As a clinician, the NHS long-term workforce plan for the NHS, there's not one for social care, is emphasising a massive increase in the number of nurses, for example. That's also going to be needed in social care, more and more care workers. The traditional pathways to training are probably not going to be sufficient. What are you seeing on the ground in terms of providers innovating, using digital platforms perhaps, and regulators adapting to the idea training can't be judged or inspected in the same way as it was perhaps before?
Absolutely. I myself was a Project 2000 nurse. There was a massive group of nurses due to retire. We were part of that resolution. And actually what we found was as people got more and more frustrated, you were losing more than you planned on. And that lack of long-term vision, in the NHS, it was very short-term, it was that 3-year window. But that lack of long-term vision is meaning that people don't have that sense that actually I can have a career here that's not doing this same job for 20 years. The regulator has to also adapt. So the NMC changed its guidance around what the course should involve for nurses. It should have an element working in, say, a care home as part of the core course. But the regulator isn't coming in saying, hey, what nurse mentors have you got? How are you engaging with those programs? So we're not developing that long-term vision going forward, and we're not actually looking at that long-term. Actually, if we give them a really good placement when they leave, they may come and join us, combined with how do we develop the clinical skills, not just the catheterisation and venipuncture that the GP no longer wants to do, but the wider skills that are of interest to the nurse. Because the broader the experience we can offer the nurse, the more likely they are to stay, the more likely we are to need things like healthcare associates that can sit underneath the nurse, take some of the workload and make us a more attractive prospect.
And people don't realise actually nurses, when most people have the visualisation of a nurse, they're working in an acute setting. Obviously now the policy is we want that to be in the community. Social care, there's some varied, amazing opportunities for nurses, which you've alluded to. One very final question, 12 months, in the next 12 months we're going to have a general election, almost certainly. As a clinician, working with regulatory bodies and providers, 2-3 big key things that you would love for politicians to do in respect to the sector?
So we need to stop talking about a joined up plan. We need to actually join the two sectors. There isn't every area that can cross over, but there are huge areas that can integrate better. We need to stop thinking of winter plans. We need our government to sit and say actually there's pressures on the NHS all year round and what do we need to do, and we also need to look at actually how we look at overseas staff, because one of the challenges that we faced is the combination of COVID, Brexit and the exit, and they're not making people feel welcome here. That has had a huge impact on the NHS. We went from, during COVID, being able to draw nurses into our sector because there were shortnesses of staff, equipment and budgets on wards, and we're losing them again, and we have nobody to replace them with. So our government, whoever that may be, needs to have a plan.
And to welcome international clinicians and healthcare professionals, not just for their skills, but also the richness that they bring to the country.
Absolutely. And otherwise, what we're actually losing to them to is the private healthcare sector rather than the private social care sector, and that's where we need them most.
Well, hopefully Voice of Care goes out nationally. somebody will be listening, and
We'll never know.
thank you so much for your time and your passion for it.
A pleasure. Thank you for having me.
Pleasure.
Thank you.
So I'm delighted to welcome Shaleeza Hasham, Director at CHD Living, a finalist in the Health Investor Power 50 and a celebrated entrepreneur in health and social care. Shaleeza, thank you very much for giving us your time today.
Thank you so much for having me.
Now you're exhibiting here at the show. Lots of vibrant energy. Are you really busy? I've walked past a couple of times and you've been flat out.
It has been great. Yeah, we're still early in the day. We've had lots of people visiting us to find out about all that we do, actually the energy seems really high. I think people have come because they really want to broaden their knowledge, learn about social care, how they can enhance their offerings in whatever capacity they work within the sector. So great event.
Brilliant. Can you tell us a little bit more about CHD Living? You're a director there. It's grown to be one of the most significant specialist care providers in the southeast.
Thank you. Yeah. So CHD was founded 40 years ago, actually by my mother and father. And congratulations to them. They just won a Lifetime Achievement Award for their dedication to social care. They founded it, small family business, one nursing home, 15 residents, and we've grown organically over the last 40 years. We now have 14 registered services. We've diversified a lot, so we want to provide services where you can age in place and really age well. So our focus is really on well-being and holistic care. We do domiciliary care in the community, including very complex care. We do rehabilitation for people with acquired brain injuries and traumatic brain injuries, and we're one of only 5 approved NHS providers for ABI care.
Fabulous.
Care for young adults with enduring mental health, and then traditional residential elder nursing and care services.
So it's the full spectrum, and congrats again to your mother and father.
Thank you.
The sector is vibrant. You've said there's great energy here. It does face quite a lot of challenges.
Absolutely.
Workforce recruitment and retention is a huge issue. So many reports, Care England, Home Care Association, calling for more funding. You, as an entrepreneur and someone who looks at the big sector in a much wider frame, there clearly needs much more recognition and true funding for the sector, surely.
Yes. We have seen a real shift in our area, actually, working with Surrey. We've worked in partnership with them over the last, since COVID, and supported over 800 hospital discharges through our care services, either for long-term care or as part of their care pathway. That joined up working is really important, because actually if you look at the cost of an NHS hospital bed to the government versus the cost of a care bed, if we can actually work together to streamline that process, we're going to save money, we're going to sort out the NHS, and we are the social care sector is one that needs to be recognised as part of the solution. With the staffing issues, rising costs of living, we've been very lucky. We're almost at 0% agency, which has been supported by healthcare assistants being on the skilled worker shortage list. We've brought in almost 200 staff. And I mean, it's expensive to the operator, but actually you're employing people who are very, very skilled, often nurses in their own country, and supporting their professional development. And if you really support these individuals, your retention is going to be better, right? And I think, your brand, the way you present yourself as an organisation is so key to that recruitment and retention, and what you do for your staff. We talk a lot about ESG, it's the new buzzword. We've been doing it for years. It's just another business challenge. It's how we present it. But people are getting savvier, but every stakeholder related to social care is looking at what is this organisation's values, what are they giving back to the community, how are they supporting the families, the workforce, the local community. And I think, we're getting there. We've got good voices speaking up for the sector, and that's what's important.
No, absolutely, and it's great to see the celebration of international recruitment. I wanted to talk about the cost pressures you talked about on providers, and that requires some innovative thinking and pooling together of resources and know-how, and I think that's something that you've been doing for a number of years with Spectrum Care. Can you tell us a little bit about that, because that's leveraging the buying power to help operational efficiency? Yeah,
exactly. So I'm also a director of Spectrum Care, founded 20 years ago by 4 care home operators. who basically sat down and said, well, look, I've got a home here, I've got a home here, I've got a home here. You know, each of us has 40, 50 beds. Let's pool together and let's go to the suppliers and let's negotiate better pricing. Not for profit, and we work on a rebate model. So it's free for members to join, free for suppliers to join, but we're owned by care home operators. So we vet everyone. We only use suppliers that we have used ourselves, and then we provide to our members the best personalised pricing. So we are basically a procurement team for you. You don't have to do any of the hard work. We look at your invoices and we save you money. We also do a lot of educational and networking events with some, great partners like Barclays, Colliers, PwC, sector-led events talking about all things that are important to operators. And we've just partnered with the Caring Times Owners Club as their official procurement partner. And actually, there is no downside to this, because the more you spend with Spectrum, you get a rebate twice a year. So you're not only getting better pricing, but you're getting money back to the business, which helps with cash flow, which is very, very important in these challenging times.
No, absolutely. As you say, the National Audit Office has done a report recently into the sector talking about the fragility of providers economically, and therefore for you to be able to help on that is absolutely amazing. One final point I wanted to cover with you. Many people that look at the social care sector, they always look at it as a cost. Sometimes the language is quite negative. We're looking at the elderly population, but actually, if we turn that head around, it's the longevity is something to be celebrated. Now, I know that's something really close to your heart. I was very inspired to read about your work in terms of Adopt a Grandparent charity, which came up with an idea to alleviate social isolation and loneliness. It's mushroomed to 100,000 volunteers globally. Tell us a little bit about that. That sounds amazing.
Yeah, so with all of my spare time, I managed to found this charity by accident. It was a localised project which has become an international charity. We use technology to bring the community in to those who are either living in care or socially isolated or loneliness. A recent government report said that there are 200,000 people living in care in the UK who have not had a conversation with a family or friend in a month, and that loneliness, people who are lonely are 26% more likely to die prematurely. So this is really important. We hand pair our volunteers with people living in care or in isolation, and they have regular calls. This is a befriending service. It's about the power of intergenerational relationships. So it benefits the youngsters participating and the elder person, who we have so much to learn from. And it gives them so much joy speaking to someone, talking about their history. It helps with their cognitive development, their recall. It helps with their mobility. And a lot of our volunteers do this as part of their Duke of Edinburgh Awards scheme. So yes, we're growing.
I'm going to keep that in mind. My daughter's about starting off with that. And you've been recognised by the CQC as a pioneer for this.
We have. The CQC very kindly identified during COVID that we were innovations and using technology for the community. And
the sector is, from your perspective, positive and something to celebrate in terms of allowing people to live their fullest lives throughout all their lives.
For sure, and there's so many ways you can get involved with Adopt a Grandparent. We're exhibiting here today. We rely on sponsors and partnerships. We've got loads of care homes waiting to sign up. We need people to work for us and volunteer. So I'd love if anyone is inspired by this to get in touch with me.
Well, the Voices of Care podcast will go out nationally, so you've heard it here.
Super.
Shaleeza, thank you so much for your time and for your energy today.
Thank you, Suhail. Thank you.
My pleasure. Thank you. I'm delighted to be joined by Ravi Sodha, the director of ACI Care Group. Ravi, thank you so much for giving us your time here at the Care Managers Show. How are you finding it?
Yeah, it's really good actually. It's good to see so many people here, and I think what's really good about this show is there's just so much learning for managers, and not just managers, actually anybody in care. So rather than just being about selling products, which a lot of events can be, this is really about kind of developing the sector, which is, I think, is really exciting.
So it's a chance, an opportunity. You're tremendous expertise in the sector. It's a chance to learn and share best practice as well.
Yeah, so I mean, I've got my group managers meeting in about 10 days' time. So where I get us all together for Christmas, and I'm learning stuff here that I can then take to them for those that couldn't be here today. So which is great.
Talking about your group managers, obviously ACI Care Group, can you tell us a little bit about that? Residential care, it's growing, it has grown.
Yeah, so we're the ACI Care Group. We started coming up to 7 years ago now.
Yep.
Where we took over our first home. And yes, we do residential and dementia care. Technically for older persons, it's hard to nail down what we do because a lot of people say it's elderly care, but it's not, because I think our youngest resident is about 50.
Right, yeah. Trust me, that's not elderly.
Yeah, no, I know.
From my perspective. Okay.
But also, what is residential care? It's nobody knows. The way I always see it is, and we've widened our kind of service users, what quite a lot of saying is, actually, we'll do anything that we can meet your needs. So it's really more personalised than just trying to shoebox into kind of residential care versus nursing care, because I think the lines are so blurred now.
And that line might be, as you say, artificial, because personalising the care journey for individuals is the thing that's going to help them thrive.
Exactly, and there's lots of nursing type care that we can do because we have the work with district nurses, etc. But it's I don't think it's possible to define what we do and what we don't do. I think it's more you just look at each individual case and see how it goes. And I think that's part of the problem in care, is too many people just think, oh, I must need nursing. And actually and it's a great environment for some, but for some it's really not going to help.
Well, the last 7 years, you've said it's been a bit of a journey. It's been an extraordinary time in this sector. We've had Brexit, political promises to fix the sector, not fix the sector. What have you seen? I mean, there are challenges, of course, within the sector, but you're a very positive person. But clearly we can't ignore the fact that the sector has a need to be properly recognised at the highest levels.
Yeah, it's there's a lot of problems. Obviously funding shortages is a huge one. The worker shortage is another. I think Brexit kind of caused a problem with the workers, but also actually helps because it allowed us to sponsor people from overseas, which is great. But I know a lot of people were saying they want to minimise that, which would be hugely problematic. But I think my view is, I don't necessarily like it when politics gets involved. Of course, there's so much is funded by the government, so it needs to. But when they talk about funding, so much of the issue comes around going is they talk about wanting to spend more money in care, which is great, but then they want to talk about bringing more people under state funding, which actually just dilutes what's already there. So I think nobody really knows how to fix it, which is why it gets kicked into the long grass, because it's too much of a long-term plan. So I think, in my view, generally, unless it's a little bit of announcements here and there, I think it's better for us as providers where government doesn't get too involved and kind of lets us plan and deal with our businesses that we know how to do.
Well, on that topic, the issue of workforce is vitally important to the sector. And I know you are one of the speakers here around the topic of empowering and upskilling the workforce. Can you tell us a little bit about the key things that are most important to you and what you'd like to share with people here around that issue? Yeah,
I mean, I think obviously what I'm first going to go into in that is looking at, why? What's the benefit of it? And obviously for a lot of the managers here, a great benefit is as people are empowered and take on more responsibility, it makes the life of a manager slightly easier because you can trust your staff. They can do bits and pieces when you're not there, which is hugely important for managers. But I think it's a huge retention issue.
Yep.
I think what I found when I first came into care is kind of the churn of carers was we're constantly losing some, hiring some, losing some, hiring some. And then since COVID, it's been losing some and nobody wanting to take on those roles. So actually now it's about how can we boost our staff team? So one is that they stay loyal to us.
Yep.
But also that we can minimise those vacancies, because what we have to realize is a stable staff team and one that works well together, that's what gives the best outcomes for our residents. And I think that's where sometimes the conversations go too much around going about the pounds and pence of recruitment, but it's actually all about outcomes. And you can only do that with really powerful and strong staff team.
And also giving them the skill set to develop their own careers. And we've got the final question I wanted to cover is that as we look ahead, the more and more need for social care, which is great for the sector. It's going to impact more of us. We're going to need more workers, and we're going to need the current workers to upskill, to use your phrase. Current training regimes are good. Do you see more of a role? We need to innovate, digital, personalise the training aspect pathways?
What I think is, look, training providers out there being really innovative. There's a lot more technology in it, doing things flexibly, remotely, a lot of like train the trainers now, which is great. I think that's the best thing, to have people in-house to train. But you can do those remotely, so you're not spending lots of times out of the building, which is fantastic. But I think the real way to fix this is looking at some of the discourse around further education for young people. I think there's always been this big push of saying, oh, well, at 16 you should stay till 18 and then you should go to university. Some people, great. You know, it's definitely the right choice. But for others, not so much. I speak to a lot of colleges who are doing level 2s and level 3s in health and social care. And then but you've got people who go and do those because they're told you have to stay at school. And then they come out and they're not ready to come into work into
They
care.
could be disillusioned perhaps because of that environment.
Yeah, whereas I think the best thing is actually let's look at 16 you can come in, and in a care home, you know, if say we look at starting salaries, is I looked at, and our group, for example, we don't pay the minimum wage, we pay above that, and it's something that I think is right to do if we can. And so you can start full-time as a 16-year-old on somewhere around £23,000 a year. And if you think about it, that compares to a graduate at 21 or 22 who earns only a few £1,000s a year more, but has got £40,000-50,000 in debt. And then we train them up. We get government funding for training. To do your level 2, your level 3, your level 5. And I think we need to attract those people that are ambitious, maybe don't want to go down the traditional route, because there's no reason to say why you can't go from a care assistant at 16
to level 5 and managers
to a registered manager within 10 years. You know, these are things. It's a career. You know, you can even go further, and registered manager is not the end of it. I think as the sector turns into, we're having more and more groups like ourselves, and then we have to hire our own head office staff. We have operations managers, quality compliance, trainers, and there's a huge career opportunity for people that don't need a degree and don't need to go through that hardship of the cost of living crisis, being able to afford to go to university, being able to afford to live there. And again, there's different options. And also I think is, we always look at the future of the workforce, and everyone worries about AI. AI can't take over a care homes. You know, and I use it already, it's fantastic, but it can't do that. People also say in offices going is work-life balance. For us, generally a full-time member of staff will work between 3 or 4 days a week. So that means you've got 3 or 4 days a week, you've got off. No one contacts you from home, you've got time.
So it's a quintessentially human endeavour. And it perhaps allows a democratisation for people, as you say, who might be put off by incurring debt. So the care sector, from your perspective, is one that people, youngsters, wherever they are in school or college, should look at with very positive, open minds.
Yeah, look, if you're going to go out there and work in AI, or if you're going to work for banks, accountants, all these stuff, great, you know, and that's fantastic. But if you're looking at, you don't know what you want to do, is we need to be changing the discourse to say, actually, care is an incredible career to go through your whole life. You know, something that can take you from the start right to the very finish. I think once we change that discourse and don't say, oh, it's the low paid sector, because we're not anymore. I think, yes, there are some, but lots of people are moving away from that. And, you know, announcements on the minimum wage in the autumn statement helps us move away from that whole low pay sector. And I think this is where we need to change the minds of people about what care is. And care is a fantastic place to be and is the future of jobs, I think. But we just need people to think about that and realise it.
On that very positive note, Ravi, thank you very much for your time and joining us. I really enjoyed the conversation.
Thanks for having me.
My pleasure, my pleasure. So that's it from the Voices of Care from London's Excel here at the Care Manager Show in partnership with Caring Times. It's been a privilege for me to listen to so many of the speakers and luminaries share their insights and wisdom. If you've enjoyed this episode, please like, follow or subscribe wherever you receive your podcasts from. And if you want to find out more about how we are truly enabling the healthcare workforce of the future, please visit newcrosshealthcare.com/Voices of Care. In the meantime, I'm Suhail Mirza. Thank you very much and I look forward to seeing you on the next episode.